But basically, what I want you to understand is how we approach back problems. And it might be a little bit different than a traditional core stability program. And I'm going to speak to that in a few minutes. But there's the most common way you get a back injury is what we call a repetitive strain, which is a low amount of force that builds slowly over time. But it's done so repetitively, these movements, that as it accumulates, finally the tissues in your back give up and they get injured. So how that works is we're going to introduce something called the joint by joint model. Now this was made up by way smarter people than me. Mike Boyle and Gray Cook are experts in physiotherapy and personal training that came up with this. And essentially all it is, it's a model of how the body moves. And it's basically our body's a series of linkages, and they alternate between areas that are supposed to be stable and areas that are supposed to be mobile. So if I build you from the ground up, your feet are supposed to be stable, your ankles mobile, your knees stable, your hips mobile, your back stable, and your thoracic or your rib cage area mobile. So if you mess with that formula, you start running into trouble. So an example would be if you take an area that's supposed to be mobile and you make it stable, so it stiffens up, then your body has to gain mobility somewhere else in order to keep you moving. So today we're going to start with a really common scenario we find in clinic where the hips are supposed to be a mobile area, but oftentimes because of our sedentary lifestyle or whatnot, they get stiffer over time. And then when they're stiff, again, your body has to gain mobility, and guess where it gains it? It transfers and gains movement into the lower back. So now you're asking an area that's supposed to be stable to be mobile. And the soft tissues and the discs and the ligaments and whatnot won't like that. So one of the differences you're going to start learning today is you've heard of core stability classes. I don't have anything against core stability, but basically if that's what all you do to try and help your back problem, you're going to have a fight if your body is compensating, if your back is the victim and not the culprit, and it's your body's having to have it be mobile to compensate, you'll have a really difficult time creating stability. So the approach we want to take is a three-step process. Basically, you want to take the tight spots and start to loosen them up. We're just going to apply a little WD-40 to the tight spots first. And then step two will be to stabilize the loose spots. That'll happen almost automatically. As you start to loosen up the tight spots, then you'll automatically start to stabilize in the low back. And then what we do is we add a little bit more duct tape to the loose areas, which is what we call core engagement. And from there, once you've loosened up the tight spots and stabilized some of the loose spots, then you just have to build endurance, build some strength, because those movement muscles need to be able to carry you around all day long. So that's sort of the progression I want to try and do throughout the next coming weeks. We're going to start with some really, really basic things today. I'm going to start getting you to do these 2 hip mobility tests so you can see for yourself if your hips are moving the way they're supposed to be. And if the answer to that is no, then the exercises I'm going to start walking you through today, they're called the hip mobility level 1 or hip dissociation exercises. That's going to be your roadmap to how you can start gaining some movement back in your hips. And that as you start to gain some movement back in your hips, your low back will stop being asked to do a job it's not really designed to do.